At the heart of every strong community is the well being of its youngest members. We believe that when children are given a healthy, supported start in life, physically, emotionally, and socially, they are empowered to grow into confident, resilient adults who shape a better future for us all. I would like to request the President of the conference, Dr. Mukhtar Hussain Bhayo, Head WHO Head Office, Sindh, to share a few words with us.
Thank you, distinguished esteemed guests, Madam Sadia Rashid, President Hamdard Foundation, Dr. Sapna, Dr. Fatma, and all my future leaders, actually, the bright students we have heard this afternoon. I'm really glad to listen the views, the way they presented regarding health. This is really inspiring stuff for me. So thank you very much, Madam, for continue hosting. This is 33rd time. Continue Hamdard Foundation is hosting this International Children's Health Conference on World Health Day. And as Jamshed reminded me, being son of soil, we cannot forget Shaheed Hakim Saeed Saab for his efforts during his life. And thank you so much for continue his legacy. For all the things what he initiated. And I'm so glad. I was emotional even to listen to all these things and see the way you are structured and you continue to take and carry forward.
Thank you.
Thank you, Madam, for this. So this will go long way, actually. This just like today we are together on this World Health Day, starting from tomorrow all over the world. But in Pakistan, it started just now with the kick-off activities from Hamdard. So this is another pride moment. Hamdard Foundation is leading. Even the global events is starting from today. So it will formally be tomorrow, and today everyone will be talking. Even the Geneva headquarters, WHO, you listen to our Director General message, and regional office, they know that even I'm receiving the messages, are you there? So it means how important this event for all WHO Global, that if we are here, we are co-hosting you actually. And this is global hosting of the world of the events. So this is just kick off, start of activities. Throughout the year, it will go on. But this is just a start. So how important this event is, that's why I'm trying to elaborate you. So let me, really formally request the President's gratitude to all team behind this. I can see Dr. Other also colleagues around. They did a lot of work, behind all this. Thank you. So the theme is, this year theme is, of course, further regarding future. If you want to save your future and there's a hope for your future generation, we have to work and invest in a beginning of this, our female, women, and the children, actually. They are the two areas where we need to invest. And this year we are actually reminding, WHO is reminding all the communities to do something additional to these two areas of the health system, which is mothers and newborns, actually. Maternal and newborn health is critical. This will be the priority for year 2025. And this is very unfortunate. On the one side, we are saying that maternal mortality has been reduced. Infant mortality has been reduced. Yes, it has been reduced. But the pace we were expecting, reduction is not achieved that level. We continue to see the children dying. We continue to see the mothers dying. For what? Why a mother is dying? When I discussed on the maternal death issue, I became emotional. How a mother is dying to do what? To give birth to our next generation? Without a disease? Without infection from virus or bacteria or something? Without she did anything wrong? For doing something right? For giving a birth to next generation? She is losing the life. And all our communities are just watching. Later die. And when I was seeing the magnitude of this problem, every 7 seconds, it's not a just joke. By this just 2 hours we are here, from 11 to 1. We have lost 1,000 mothers in the world. 1,000. In this just 2 hours we are here in the conference. So to that severe magnitude we are ignoring. The world was ignoring. I don't know who are We are diverting our resources to areas where we are not surviving, saving a lot of lives. But here, the lives without, losing without any, the fault. And who are the mothers actually? They belong to poor communities. They are illiterate because of lack of resources, because of cultural taboos, because our health services are not available. They are not accessible. So these basic things we could not provide, and we are losing the mothers and children. And who can help actually? It is not the responsibility of government alone, I'm telling you. Whenever we see the services lacking, the first response people start to ask what our government is doing. But what our other philanthropists, what our other health partners, what our communities are doing. Everyone has to play the role in this healthcare services. It is not one only university or one organization, agency, WHO role or government can do. We all have to play a vital role in this. Own the responsibility, even, the awareness. This is the biggest area. Our communities don't know even where to seek help. Mother is dying because of obstetrical labor, and the community is not bringing this mother to a place where she can get this cesarean section or she can be helped. This awareness is not available. Prenatal care is not done. The mothers are coming directly to get the delivered in the hospitals. It is the first time a doctor is seeing you. You are the one you must be witnessing every day this business. The poor ladies are dying, and she came here as a delivery, this obstetrical labor, and the bleeding is happening, everything. The child is at risk, mother is at risk. And when you ask, where were you? She came as the first time to a doctor. So this all awareness is lacking. This is the basic thing. The community, our NGOs, our social networking, our universities can play a vital role in this. The first, this referral system is we are missing. And then I was saying that if other than pregnant ladies, why we lose our children because of no food? Why we are losing the children because the vaccine is available, we are not providing the vaccine. How many children die because of measles? Why people are crippled because of polio? When whole world is giving, vaccine is available, vaccine providers are available, facilities are, we are not using the vaccine. Either community is not aware. This is the biggest question. I think request to all the people are connected. Also, the children also they have to play a key role. You are now adult. You have to save your other younger children in your families and convey this message to other community. Please, get the children vaccinated and get the mothers help where it is available. So this utilization of services is the key area where I request everybody to contribute us. And we have to, like the WHO DG was saying, that now we are jointly working on this maternal and neutral area. Not only WHO, but WHO, UNICEF and UNFPA, 3 UN agencies are joining hands to save this woman, the initiatives, every woman, every newborn, everywhere. So that strategic plan for 5 years in Pakistan has been approved. This is the good news, actually, that we all 3 UN agencies have jointly prepared a strategic plan, and that has been presented to government of Pakistan, and they approved to go ahead. So this is a good science. On the one hand, we have good science. We have like universities, Hamdard, all these good WHO, UNICEF, and all are trying. On the other side, our communities are not ready. So we are lacking on the awareness side. I would request everybody connected here to help us in getting awareness for the malnourished children, for the mothers dying. So thank you very much. I don't want to take your much time. I have listened already so many good messages. And the good success is COVID-19. Pandemic we were able to face, and we faced successfully. Pakistan was one of those good countries who have faced the COVID-19. And we were feared in the time. I remember when the COVID-19 was coming to Pakistan, we were saying we don't have resources, how we will face? Other countries were dying, and there were people with thousands of people on the streets where they were dying. I was thinking in Islamabad that how we will face. But we have this resilience. Pakistan has this potential. We did it, and we did it better than many developed countries. So why can't we save our mothers? We will be able. The only thing is concentrate, aware, and please divert resources. Thank you so much, madam, for all this.
Thank you.
Thank you.